Hello, my name is Dr. Matthew Regulski. I'm the Medical Director for the Wound Institute of Ocean County, New Jersey, and Senior Partner at Ocean County Foot and Ankle Surgical Associates. I want to bring to your attention today about a new fast film forming silicone that I think has made significant progress in the treatment of both chronic and acute wounds. I've been in practice for 17 years and I treat chronic wounds of all types. And this has made a substantial impact on the treatment of very hard to heal chronic wounds. I'm going to show you cases of those and describe to you in detail how the mechanism of action works that will perpetuate a better and a more proliferative wound healing paradigm in all types of wounds. And yes, it's indicated for our standard chronic wounds, diabetic, venous, pressure ulcerations, but please don't forget in acute wounds, when you have post-surgical wounds, when you have burns, when you are having skin tears, when you have fissures, post-traumatic wounds, this is another excellent realm for us to use StrataGRT. StrataGRT, as I said, is a fast film forming gel, but it makes it full contact and it is very flexible. Remember, wounds have ridges and valleys and peaks to them. This is not a flat level wound that you see. So we have to be able to fill those valleys, and utilizing StrataGRT in this gel form is able to fill in all of those nooks and crannies so that we can maintain that film status over this chronic wound. And by doing that, we do a couple of things. We facilitate healing quicker by maintaining proper hydration in a wound, thereby facilitating better keratinocyte migration. And at the same time, it is a semi-permeable film that is formed, so we allow exchange of gases. But we also are able to keep the water content in there because, as you know, we have to have proper moisture balance to facilitate cellular migration. And one of the great features of it is it's very inert. There's no recorded pH of it. It doesn't have excess hydrogen ions, doesn't interact with secondary dressings. So it's very safe to use as there's no steroids, there's no alcohols, there's no parabens, there's no fragrances in this as well. So it's very safe to use on infants, children, people with very sensitive skin, and also pregnancy and breastfeeding mothers is another avenue for us to be able to use this to resolve those issues that accompany that. I think that another good feature of it is that it does have a bacteriostatic capability, so it protects you from microbial invasion and chemical invasion, while at the same time retarding the contact dermatitis that occurs in chronic wounds when we are not managing exudate properly, as that fluid gets around that wound edge and can create redness and irritation. As we go through these complex wounds that you're looking at, I think it's very important that we see the diabetic foot ulceration, we know, which is the scourge of our society. 1.2 seconds, every 1.2 seconds there's a diabetic foot ulceration. 3% of the world's population now has a venous leg ulceration. And of course, with the pressure ulcerations are increasing exponentially because as people are living longer, we have these chronic problems that are occurring, causing more of these chronic diseases. I think another avenue for that I have used these in is in post-surgical changes. As people do take triple antibiotic ointment and put that over skin incisions, this is a much better product to use instead of that. So you don't get the irritation, you don't get the sensitization of Neosporin and polymyxin. Here at the same time, we're forming that nice film over our surgical incisions, but at the same time allowing exchange of gases and maintaining proper moisture balance, but you will not macerate the tissue because of that exchange of fluid that occurs with StrataGRT. So I hope that you understand what this mechanism of action is. Very simple, it's very easy to use. It comes in a tube that you would just squirt that onto the wound to the thickness of a nickel. You can use a secondary dressing with it. As I said, it's very inert. But another avenue is that you can use it in these hard to place areas where you don't have to shave skin, scalp, on the face, areas where it's very hard to get a dressing into. This is a proper and a very good place to use this because of the film forming capability that it does, while allowing maintain the hydration of the tissue and allowing exchange of gases as well. When we look at people that have post-Mohs surgery, cancer surgery, another excellent place to use this because those are very chronic, those are very hypoxic areas, they can get very desiccated as well. And with the film forming gel of StrataGRT, we check all of those boxes that we need to convert that chronic wound into a more proliferative and epithelial enhancing phenotype. When we look at older people as well that have a lot of dry skin, a lot of fissuring, this is another great aspect to use on the posterior heel, over the malleoli, anterior tibial crest, and those big old hammer toes that people can get that rub in shoes and things that create a chronic wound that can lead to devastating complications, as we see in our diabetics. Another excellent avenue to use on this dry, cracked skin. So please avail yourself of StrataGRT. Very easy, very simple to use, but has a myriad of advantages so that we can move these chronic wounds into more proliferative phenotype.